in the private sector.
The code that we're keeping secret is the patient's records. And now we're being asked by the executive branch, President Obama, the leader of that branch, the legislative branch, Nancy Pelosi and Senator Reid, often in the news, to break the code with the patients and deliver all of their records into electronic medical records. Now, I would like to think that records are to be kept safe, but each of us know, we've heard and we've read, that even the Pentagon records are not safe. Often our bank records are breached, our Social Security records are breached, and we have a government that wants to start a national health insurance program. And in order for the patients to be part of that program, they have to agree that their doctors will put all of their medical records in electronic medical form.
We're now being told by physicians advising the president that we take the Hippocratic Oath too seriously. I've never heard that until it was published, so I think it was in the Times, it was in the Journal. I just didn't know how to respond to that when I met the gentleman at the Aspen Institute who was quoted as saying that. Then finally, Ted Kennedy, if he had to participate in this government-sponsored program, would never have been able to travel off to Duke and have very, very expensive health care provided in a disease which is almost uniquely, almost 100% fatal. They probably would have asked him to go back to Hyannisport and said, "You've had a great life, you've been a wonderful senator, now go home, you're going to die." And I'd like to know who would have told him that.
When physicians graduate from medical school, we take an oath, the Hippocratic Oath, to do no harm to our patients. It's a very important philosophy to us, and we uphold it and hold it very dear to our hearts. Plato used to say things like, those with a poor physical constitution should be allowed to die, the weak and the ill-constituted shall perish. These government programs that are being proposed, I think, are very scary in the sense that physicians could be induced to violate the Hippocratic Oath, and we absolutely should not stand for it.
People are just not going to go into healthcare when you know the government can just turn around any day and decide, hello, we're not paying you, we're not doing this, and you have no freedom with your patients.
Well, I think we'll always have doctors. The question is, who will become them?
There's a limit to how much of a financial penalty each individual practitioner is going to be able to bear in order to, quote unquote, do the right thing. And this goes to the violation of the doctor-patient relationship and the trust that our patients need to have in us. If the patient is sitting in the examination room with us and they're wondering, is the doctor not ordering a test for me because he's going to get penalized if he does it, this is a major, major problem for patients and physicians alike.